Gavin, James, and Colm. As you can see, it's just myself and Colm today. James is busy with other commitments. So if you watched the last episode, myself, James, and Colm spoke about the response by the Irish government to the coronavirus and the subsequent lockdown. And for those of you that don't know, our dear friend Colm is currently living in Sweden. He's from Ireland as well, but we could say Sweden has become his adopted home over the last 2 years. For those of you that don't know, Sweden, with the whole outbreak of the coronavirus, Sweden decided to not go into a full lockdown, and most businesses and schools remained open. And as we can see, it looks like their approach, it might be the right choice. But of course, hindsight is 2020. So in countries like Ireland, UK, USA, that did do strict lockdowns and strict restrictions, with hindsight being 2020, it's easy for us to say, a Swedish approach would have been better off here. But obviously at the time, no one knew very much anything about it. So just going off that Colm, could I just get your personal opinion on a Swedish approach, say, versus an Irish approach, or even a UK or USA approach?
Sure. It's a good question to start with. I think one of the things that we have to say about the approach that has been taken here in Sweden is that it is a little bit refreshing to see a country apply a different approach, that we don't just have a universal approach. And I say that because to me, this is a very novel situation. Even the name of this disease, as we know, COVID-19, it's a novel coronavirus.
Yeah.
These are very unprecedented times. And this idea of a lockdown itself is a novel approach to a novel situation. So what I would say is that from a research point of view and from a long-term perspective, isn't it a better thing that we have a country that has applied a different approach? Because at the end of the day, we'll be able to compare which countries got it right, which countries got it wrong. If every country was doing a lockdown, a universal approach to this thing, we wouldn't really be able to see and test out different strategies in the long term.
Now, before we started the show, I was just doing a bit of research on the Swedish approach, and I saw an interesting statistic here. It says the mortality rate in Sweden is 38 per 100,000 people. Now, that rate is one of the highest in the world. However, it is actually it's much lower in comparison to countries that went into a lockdown. So I found that extremely interesting, that Sweden, although they have one of the highest rates, in comparison to other countries that went into lockdown, because they didn't, I think that rate is actually quite acceptable, or even more reasonable to say. So would you think, if this was to happen again, would you think, based off the success of, the success so far from Sweden, do you think more countries would adapt this approach?
Well, look, I mean, any debt is a debt too many from this thing.
Of course,
we don't want anybody to be passing away, no matter what country they're in. But with regards to this death rate, there's been a lot of people who've had opinions about Sweden, and from what I read in the media, irrespective of whether it's coming from London, whether it's coming from Washington, New York, even maybe Dublin, it's my take on the situation that there seems to be a bit of a media agenda against Sweden. And whether that's being directed by the societies in which these medias operate, or whether in some cases the government is helping to influence what the media are saying, which obviously isn't the case back home in Ireland. But whatever the case may be, my reading of it is that there's a media agenda against what's taking place here in Sweden. And I'll tell you why. It's my take that, a lot of governments have restricted people's freedoms. They've taken away their basic movements, the normal things we do on a daily basis, seeing our friends, shaking hands, hugging our grandparents, all of these things. And of course, if a country is following a different approach, like I said, if they're the outlier who aren't following this universal approach, isn't it fair to say that we want to name and shame that country to try and justify our own actions?
Of course. Anything that's different to the societal norm is usually not okay.
So that's what I would say about some of the hype around mortality rates. However, with regards to 38 per 100,000, if that's the number as it sits today, it is high. It is higher than some countries that are neighbors, such as Norway, such as Denmark. And, in hindsight, I think that I would agree with the chief epidemiologist here, Dr. Tegnell, when he said that it wasn't a perfect approach, that he would make changes if he were to implement this strategy again, if he could go back in time. But let's also take into account that in Sweden, the quality of life is superb. The healthcare system generally works very well, and people live to be pretty extraordinary ages. So let's also say, when we look at the mortality rate, although I'm not being ageist by any sense of the word, 90.4% of those who have died here in Sweden have been over the age of 70 years of age.
Yeah, now, with that mortality rate in mind, I don't know if it applies to Sweden, but I will say, in general, the average rate of someone, or sorry, the average age of someone who dies from coronavirus is older than the average age of someone who dies from normal causes. So although the figures might be skewed because we don't know how old these people are, or if they have any pre-existing conditions, which would obviously make the virus worse for those people. So I suppose that's something, when you see these numbers, that's something that's not often taken into account.
Yes.
And although you said there might be a media bias towards Sweden,
Mm-hmm.
I think we could agree that in general, the media would be using this as, let's say, scaremongering or fear-mongering for ad revenue or whatever.
Of course, of
So
course.
obviously, the public is going to be a bit unhinged.
Absolutely. And my response to some of this media criticism of Sweden, as I say, one death is a death too many with regards to the coronavirus. But if we were to look at what the World Health Organization estimate, they estimate that the mortality or death rate from coronavirus is 1 to 2% of those who contract this illness. Now, in Sweden, according to the official figures, and I have to be honest from living here, there is a lot of trust in state organizations in Sweden.
Right.
There is a lot of clarity. I mean, if you lived in Sweden, I could Google your name. I can see where you live. I can see how much tax you pay. There is a huge amount of transparency between citizens and between the state. Everything is extremely clear.
Right.
So according
And
to the
you wouldn't
latest...
get that elsewhere.
No,
Sorry to
you
interrupt.
absolutely, I agree with you. You wouldn't see that kind of clarity in most nations. I mean, even
Yeah.
if you can look at the Transparency International ranking for Sweden, I believe that the ranking is quite high. But according to the latest statistics, and I think this is a very good defense of Sweden that hasn't been offered by many people, even people living here, is that according to the official numbers, there have been 43,867 cases. There have been 4,656 deaths as of today. So if you look at that number, 4,600 out of 43,000, I mean, the death rate, it's quite low. And we have to, now you might say, okay, Colm, that's 10%, and the WHO say 1 to 2%, correct? But I have to tell you that to get a test here in Sweden which diagnoses you positive of COVID-19 is incredibly restricted. It is very difficult to get a test here in Sweden. And I can tell you that based on personal experience of what I've been through. But just to say that while the official numbers indicate 10%, most people I know, most friends of mine, colleagues of mine who have been sick, who have told me, there's a very strong chance I've had COVID-19, weren't able to get a test. So I am sure that if the actual number of people tested, the actual number of people who had symptoms were tested, the number of cases would be higher, yet that death rate, which is the key thing, that death rate would remain the same.
And you believe that, do you?
I wouldn't, actually, I should go back on it. I shouldn't say death rate, but the number of deaths would remain the same, which means that the death rate would reduce.
And is it mostly young people then in Sweden that you think would be affected?
Well,
if you think the death rate would remain the same?
With regards to mortality, as I say, 90 point 90.4% of people have been over the age of 60. 96.4% of those, excuse me, who have died have been over the age of 60, and
Yeah.
90.4% of those have been over the age of 70. So, with regards to those who are getting tested, it's extremely difficult to get a test here in Sweden.
Yeah.
You need to show that you require urgent hospitalization to actually get a test here, or you have to be a healthcare worker, a healthcare professional. Other than that, you cannot get a test here in Sweden. So
No,
I believe. Go ahead. Go ahead.
I personally think, as much as I agree with the Swedish approach,
Mm-hmm.
I do still think that their ways, or their way of operating in terms of, oh, you can only be tested if you need urgent hospital care. Although I agree with the approach, I think that is quite strange.
Mm-hmm.
Um, and it's kind of the same here in Ireland. It's not that strict, but I remember just at the start of all of this, there was a scare where I thought I had it as well.
Mm-hmm.
And I was refused testing on 2 occasions
Mm-hmm.
because I wasn't bad enough, apparently.
Mm-hmm.
But even with something as bad as this, because the way I was thinking is, I still live at home, and both my parents are very vulnerable. So I was thinking, for their sake, I probably should have got a test just for a bit of more clarity.
Mm-hmm.
But the fact that it's required, or you can only get the test if you have urgent, or if you're in need of urgent hospital care,
Mm-hmm.
um, I would be in disagreement with that, but in agreement with their other approaches.
Look, I mean, my own personal criticism of the approach here in Sweden is that there hasn't really been enough testing. I mean,
Yeah,
there's a population here of over 10 million people,
right.
and to date, since this pandemic has started and since the first case occurred in Sweden in January, there have only been 275,000 tests in total.
Right.
So the testing has been very low, and as I say, those who can receive a test are those who require hospitalization or those who are healthcare workers. That's how it
Yeah.
is. And I think it's also to maybe uh, limit the use of tests and ensure that those who need a test get a test. But I would still say that perhaps there should be greater capacity for testing here. Absolutely.
Yeah,
Um,
of course. But just in case you end up being one of those people that is, say, asymptomatic, and you don't have any symptoms, and then
mhm,
most businesses are still open,
mhm,
you're asymptomatic, and then you go out to a restaurant for dinner,
mhm.
and that's kind of the scary thing about this virus.
Sure, but well, look, I mean, something that we need to say that's important too is that I must say that with regards to a lockdown approach, I'm
Yeah,
not saying that a lockdown is something that should never. I'm not saying that. All I'm saying is that different countries have different contexts, different
yeah,
backgrounds,
yeah,
and that each country has its own particularity. So perhaps in a country like Ireland, where people are very friendly, outgoing people, they talk to strangers, they meet each other, a lockdown is necessary. But in a country
right.
like Sweden, people, I would say, not that they're not friendly, but they're more helpful. If you need help, Swedish people will help you. So they would not just maybe come up to you in the street and have a conversation if they didn't know you. People here, in my entire time living here for 2 years, people are very socially distant anyway. Before COVID-19, people on a train or a bus do not sit beside each other. If there's an empty space, they will make sure that they're sitting as far away from you as possible. Anyway,
So a bit
people
more introverted.
exactly. People do
Yeah,
not mix with a stranger. It's like,
right.
I mean, even if you're walking on the street back home, people will say hello when they walk past you. Even if they don't know you, they'll
Yeah.
say hello. That does not really happen here. Throughout the
Wow.
entire country, that doesn't happen. I mean, last weekend, I was in Malmo at a coffee shop with friends, and we were talking away, and we were talking about this topic about Sweden and the coronavirus. And an old couple who were sitting in the seat, or two, I think they were 2 tables away from us actually,
Yeah.
turned to us and spoke to us as well and had a conversation with us. And that was the
Oh,
first.
okay.
That was the first time in my 2 years living here that a random stranger has turned and spoken to me without it being for a purpose like a business transaction or checking my ticket for a
Yeah.
bus or a train or something. People don't talk to strangers here. It doesn't happen. The
That must have
closest
been a bit of a culture shock when you went there originally.
at the beginning, absolutely. People,
Yeah.
I mean, it's a shock, but people don't mingle if they don't know each other. I mean, and even if they do, the closest you're going to get is a hey, hey, keep walking.
Right.
People are very distant.
Yeah.
So it has to be taken into account that different countries can be more communal, different countries can be more individualistic. And also in Sweden as well, an important thing to know is that a lot of Swedes live lonely lives. They live alone. They have their apartment, they live alone. They don't, it's not like in even back home where university students would be sharing a flat between 4 or 5 different people. That's very unusual in Sweden. In Sweden, people either have their own apartment or they live on like a corridor where, yes, there's a communal kitchen, but everybody has their own apartment. They share the kitchen at the end of the corridor, but everybody has their own apartment. They have their own space and they live in their space.
So you could say that the social distancing aspect has kind of been ingrained in their culture anyway.
people here are very socially distant.
Yeah,
I mean, the only time I would see from working at a bar here part time on the side of my studies as well, the only time I would see people get very social is when they drink.
when they drink. Yeah.
Apart from that, people are not so social if they don't know you. And
Right.
it's very. You can look up a lot of articles online about the difficulties for international students or international citizens to move to Sweden in terms of making friends with Swedes. It's incredibly difficult.
And
Incredibly.
since the Sweden people would have this kind of mindset, or they're always kind of socially distancing anyway.
Mm-hmm.
And then obviously the struggles you mentioned as international students come to study there.
Mm-hmm.
Would you think that, would you think that the reason they are that way is why there's a media agenda against them? People might not think they're very friendly or whatever.
I think the media um, criticisms of Sweden is based on a lack of knowledge about Sweden. They don't know how people here are. All they know is that Sweden is open for business. There's things going on, and their country shops are closed, restaurants are closed, pubs are closed. So
Right.
they want to criticize. I think that they don't know about how socially distant people are. And
Yeah.
why I make the point about moving out to you, about people living alone, for example, is that even here in Sweden, when people are like 18, 19 years of age, people move out of their homes with their parents. They move out. They
Yeah.
may not necessarily go to university until they're in their 20s, but they move out. They get a job or they go backpacking around the world or whatever the case may be. But people move out. I mean, it's extremely rare to hear of a Swedish person still living with their parents at our age. Really unusual.
Yeah.
And therefore, one of the key things to remember if people are living alone or in isolation is that they are living in isolation, which means that there is less spread of a virus within the home, within the family home.
Yeah.
If you live in a communal society like Italy, for example, where mom, dad, the grandparents, and 4 children are all living in the one home, everybody embraces each other with kisses on the cheeks, and neighbors live nearby. The houses are very closely packed together, and population density is a factor
Yeah.
rather than in Sweden where people are very spread out. I mean, this is a huge country and people are spread throughout the entire country.
So, Colm, you were just talking about how Swedes or Swedish people, prior to the virus, were always kind of isolated.
Mm-hmm.
So with the isolation in mind, now when I was doing research, I couldn't find a definitive answer. So if there's someone out there who's watching that does know the answer, I apologize. But it appears that from this research, there's a lot of divide over the answer. And what the question I was looking for is, people are saying, well, maybe not in Sweden, but in the likes of USA, the UK, and
Mm-hmm.
even in Ireland,
Mm-hmm.
people are saying, when we give up our control and we're being forced to stay inside or wear gloves, wear masks,
Mm-hmm.
it's weakening our immune system. Now,
Mm-hmm.
I couldn't find any definitive answers if this is true or not.
Mm-hmm.
Some experts say it's true, some other experts say it's fake.
Mm-hmm.
Um, but with that in mind, what I'm getting at is, there's a lot of public health officials in Sweden who say that their people have um, higher or stronger immune systems than other nations.
Mm-hmm.
So I know you mentioned earlier that the testing in Sweden, isn't at full capacity. So with the testing in mind, and with these experts saying that Swedes have higher immune systems, do you think that the immune system part is kind of why Sweden is the way it is with their approach to it, or do you think it's just something completely different?
Okay. Well, what I would say is that, just to give you the context of it as well, is that the Swedish Public Health Agency, which is being led in this regard by the chief epidemiologist, Dr. Anders Tegnell, is a public agency which is separate from the government here. Okay. So with regards to whether Sweden would ever lock down in the future if things became terrible or whatever the case may be, it is always guided basically by the recommendations of this public health agency. Right. And it's important to note that while Sweden hasn't locked down, things have changed slightly. So there is public guidance in place to avoid all non-essential travel. So the size of Sweden from where I'm living in the very south, near Copenhagen in Denmark, all the way to the north of Sweden is the same distance from where I live now to the distance between here and Rome. That's the same distance. It's a huge country. Okay. Yeah. And so for me to travel to one side of the country to the other side, just for tourism purposes, it's recommended that I don't do so. Now, obviously I could because there's no lockdown, but there's recommended guidance in place to avoid all non-essential travel until the middle of June, which could be renewed again. And the Public Health Agency have lots of guidances in place for different people. So they advise people over 70 to avoid contact in large gatherings. They advise people who are over 70 to avoid shops if they're full of people. Matters like this, to keep in touch with their loved ones by telephone or by computer. So it's all guidance here. And I think that's an interesting fact too about Sweden compared to other countries, is that in Sweden, there's a huge amount of trust between the citizens and the government and the citizens, going both ways. Yes. There's a very strong social contract. So even if people don't like the current government in Sweden, if that were the case, people still have trust in the government. They may not vote for this particular government or the parties that make up the government, but there's still a high level of trust in public authorities here. And the public authorities have a lot of trust in the people. So it's not like in the US where nobody trusts a word Trump says unless you're loyal to Trump, or even when Obama was in, a lot of people didn't trust a word he said either. It's a different context again. And just like in Ireland too, maybe there's less trust in the government or prior to the coronavirus outbreak in the HSE. But in Sweden, there's a huge amount of trust between the people and the government in the people. So when the government gives a recommendation not to do something, they believe that a lot of people will follow that recommendation, and therefore that there's no need for a lockdown because everybody in the system trusts one another. So it's, again, based on context. But getting directly to your question about whether certain doctors have said certain things, while the Swedish Health Agency haven't said that Swedish people have better immune systems or whatever, some doctors or some experts have indicated that in their commentary to media. And although I'm not an expert in health and would never proclaim to be one, what I would say here from personal observation is people here live a very healthy life, extremely healthy. So, for example, just like the rest of the European Union compared to somewhere like the US, there's a very high standard on food products in Sweden, health and safety standards. So, for example, you could never purchase something like chlorinated chicken. You could never. You could never purchase anything like a chlorinated chicken or something with additives or preservatives in it, like you could in the US. So, standard and quality of food here is obviously excellent. But people here live very healthy lives. I mean, nearly everybody I know is a member of a gym or go to gyms. Even when you go to the gym in Sweden, you see people in their 70s working out, lifting free weights, treadmill, everything. People here run all the time. There's a lot of exercise taking place in public areas, in public gyms. And that's been something that I've seen a lot of people using now that the weather is improving too, is that people use the
Yeah.
public gyms that are out in the parks, which are very excellent too. People live very healthy lives. People here, generally, from my observations, sleep very early. They go to bed extremely early, maybe 10 p.m., 11 p.m. They rise at around 6 a.m., 7 a.m.
Oh,
And
okay.
also, there's obviously the phenomenon of wanting to tackle the climate emergency in Sweden. That's a very
Yeah.
pressing thing in people's minds. And people combat that in different ways. Some people drive less, they cycle more, they use public transport more. There's a high percentage of people that are vegetarian or vegan in Sweden. A lot of products that are made here are vegan products. Restaurants actively have vegan options on their menus. So people, yeah, I would say that people live extremely healthy lives here, from my observation,
Yeah.
compared to other places that I've been in or lived.
So they're very conscious people.
Very
Conscious of.
conscious,
Yeah.
extremely conscious about the climate, extremely conscious about trying to leave less of a mark on the society that you leave behind. Yeah, and people take measures to ensure that they are in pretty good shape. And I think that's also helped by the fact that everywhere you go here, there are cycle lanes everywhere that are excellent cycle lanes. In every single footpath, everybody. It's not like in some places back home where there's not enough people cycling, so people just walk in the cycle lanes. People let their
But
dogs.
would you say the way that they're so conscious, or the approach, or even the trust they have in the government, would you say that starts from the top down, or has it always kind of been that the people trust their leaders?
Um, Kind of a bit of both. It's been built up for a very long time here. That's one of the big differences too between, say, uh, as much as we may love it, like a Bernie Sanders approach,
Yeah.
trying to apply maybe a Scandinavian approach to a US situation. It's one of the big differences there too, is that if somebody like him were to be elected, you're telling me you have 4 years to get this thing done. Sweden has built this up for over a century. This has
Right.
been this has been a project of long trust, long investment, long development. So ensuring that you have electric buses all over your city, ensuring that you have public transport, a train. I can get a train from where I live to Stockholm, which is 4 hours away, and that train, prior to coronavirus times, you could get a train every 15 minutes.
Oh, wow.
And ensuring that it's affordable as well, ensuring that
Yeah.
everything is affordable, ensuring that there's proper infrastructure in place for the cycle, and that it's not just that the cycle lane is being used by walkers or people who let their dogs shit all over it. People
Yeah. Yeah.
actually use the cycle lanes here, and free healthcare, all of these different initiatives, free university. That's been built up over a long, long stretch of time. So, of course, I think it's fair to say, from my observation and even from living here, going to school here, and working here, paying high taxes, is that I know that whenever anything goes wrong or whenever I need help with anything, there's an agency I can contact, and they will help you, and they will treat you the exact same as they treat everybody else, and they'll do it quickly.
Oh,
Uh,
wow.
so there's a high level of trust.
Yeah. Now, just one last thing on the trust there with the government.
Mm.
It's actually quite refreshing to hear as a nation that they have such trust in the government,
Mm.
because when the restrictions first came into place here, the weather was extremely good. So
Mm.
we had the restrictions in place here, and then we also had a lot of people traveling from the likes of Wexford, Dublin, Kilkenny, all the way down to Waterford or to Tramore, just to go to the prom.
Mm.
Um, Now, obviously, you know, you could say if the Irish people had more trust in, maybe the government or just Fine Gael in general,
Mm.
they might have been a bit more willing to listen to the guidelines and apply the restrictions to their life. Um,
Mm.
but just when you speak about the Swedish people, it is refreshing to hear that, because so many times in society, it's always the opposite.
Mm.
It seems to be very rare that you have a whole nation behind the people in charge.
Sure. And of course there are outliers here. There might be, I think, according to the percentage polls on coronavirus, I think it could be around 20% of the population here distrust the
Right.
approach that the government have made. That's an approximate figure. I mean, it could be 17, it could be 23, but it's somewhere around that
But
ballpark.
even around that ballpark, it's still a pretty healthy figure, I think.
Exactly. I mean, it means that you have around 80% trust how the government have handled COVID-19 in this country. And that's also something to bear in mind too, that although many media sources and many people abroad comment on Facebook and criticize Sweden, they don't have to live here. You
Of
know,
course, yeah,
they don't live here, most of them. Often it's people in San Francisco or Berlin or wherever that are
yeah,
criticizing
yeah,
a country that they don't even live in. And yes, as I say, there are 20% of people around who don't trust the government's approach here. It could include people who already didn't trust in the government for whatever their reasons, or it could include people that have lost a loved one who has
yeah,
died as a result of some issues which have been in the system here, which in terms of dealing with coronavirus, which is absolutely true. It hasn't been a perfect approach, but I mean, from my perspective, living here, I mean, it's been pretty healthy, you know. Life has continued close to normal. It's not
yeah,
normal, but it's close to normal. I mean, I guess what's important to know is that, like, a lot of businesses, even restaurants and stuff, are working reduced hours. They may close
right,
earlier or open later. Um, University isn't open anymore. High schools aren't open anymore. Everything is distance learning. But primary schools are
they're
open.
open, aren't they? Yeah, yeah,
And a lot of the logic behind that has been that it ensures that if kids are going to primary school, that healthcare workers can continue to go to work. They don't have to be minding their kids, they can go to work.
right,
Um, and that's important to know. And that in that way, the child continues to receive their education, but it also kind of provides kind of a child minding facility, one could say.
yeah,
And I guess as well, if the healthcare worker has picked up COVID-19 from their work, which would be very unfortunate, uh, if the parent is still going to work and is responsible and also maybe distancing as much as they possibly can from their child, if that's a possibility in the home, it
yeah,
may actually reduce the child's exposure to the virus.
right, yeah,
So, but the main reason is that it allows healthcare workers to continue to go to work. And I think that it's actually not been too bad an approach because it seems like those under the age of 18, it appears, are less likely to carry the virus or become very ill from the virus.
yeah, yeah.
And to stop a
Um,
kid's education as a result of this is a little bit
it's
questionable.
a bit much, yeah.
A quite big question.
Now, I know you touched on, the trust within the people being one of the main contributors.
Mm,
So because of this trust that the people have, now I don't know what the media in Sweden was reporting at the time, but
mm,
we know when it first happened, in England, Ireland, and America, and of course many other countries. There was a scare that this could have been a second Spanish flu or even worse.
mm,
But we know now it's nowhere close.
mm.
Um, so when this kind of first happened, was the Swedish media kind of saying that, kind of putting out that story, or were they kind of a bit more sensible with their reporting, not trying to scare the public?
Yeah, okay, it's a good question. Let's say this. I mean, when the first case happened in January, when one person had traveled from Wuhan to Sweden,
Yeah,
and that case occurred, it still never really set into people's minds that this could spread throughout the country. It just didn't really happen. This was like,
right.
oh, one case of somebody who traveled to China and came back. You know, and I think that that was the perception of most people in the world, was that this was like a Chinese issue or an Asian issue. Even when it got as far as Iran, people were still thinking, oh yeah, this is something that will be solved in Asia. I mean, I think people underestimated the spread of this thing globally. Um,
Yeah,
but people here, I think it also, it starts from the top in terms of what message the leaders of a country send.
yeah,
um And the fact that the country was never shut down or locked down in the same way that other countries have indicates that they tried to ensure that people didn't freak out or panic. You know,
Yeah.
the closest thing to a panic that I saw here from the first week that it really started to become an issue around the middle of March when I was still abroad in the Caribbean was a lot of my friends were ringing me and reporting to me that there was a shortage of toilet paper in the supermarket.
Yeah. Yeah.
Now that was the extent of the panic, and that over time it started to reduce and reduce and reduce, and there's less of a fear. I mean, on the point about boosting your immune system, I know some people I've spoken to, some friends who tell me, international students that tell me that when they purchase their groceries in the supermarket, even if they buy, say, like a bag of lettuce or whatever, the second they bring it to their home, they wash the bag under the sink because they're terrified the virus will be on the bag.
Yeah,
But
I've
that,
even been doing the same.
and now I haven't done any of that.
Right.
And that's, I think, again, it depends on how your mindset is, what news you're consuming from your home country,
Yeah.
perhaps, and how you critique it or how willingly you go along with that news. So I think that life here has been pretty calm. People haven't really freaked out. Of course, there are some cases of people panicking and
Yeah.
worrying, but I don't think it's been the same degree of pandemonium as in certain places.
Yeah.
And I think it's in large part due to the fact that life has remained as normal as possible. That, if after this call, if I wanted to go see my friends and play soccer, we could. I can go to my university library and study.
Yeah.
I can then go out to a restaurant and have dinner and have a few pints and come home. Life has continued pretty normally.
Great. And would you mind talking about your own experience? Because wasn't there a moment there where, I don't know if it was confirmed or not, but we definitely did suspect that you did catch the virus.
Yeah, sure. Well, what happened in my case was that I had been traveling for research purposes
Yeah.
in the Caribbean. And I came home. I went to the Caribbean around the middle of February, just middle to end of February. And I was there for about 3.5 weeks. And when I was there, the first couple of cases of COVID-19 were confirmed in the region, in the CARICOM region.
Yeah.
And then ultimately, in my final few days of being there, there were a few cases in the country which I was in, which was Trinidad and Tobago. And yeah, naturally, there was a bit of concern amongst people. A lot of talk on the radio in Trinidad about washing your hands and wearing a mask or not wearing a mask and
Yeah.
mainly making sure your hands are washed. That was kind of the extent of the conversation at the time. And it was lucky because when I was there, I was at the carnival as well, Carnival in
Yeah.
Trinidad. And that's obviously a gathering of hundreds of thousands of people dancing in the street in costume and partying. So I was quite lucky that actually managed to go ahead just before any of this spread in the country. Now, when I was departing, I was staying with great people, and we gathered around the TV and we were watching as the president of the US announced that he was closing travel to the US from Europe.
Yeah.
And that was obviously a very worrying thing because at the time people were like, well, does this apply both ways? Can you fly from US to Europe, or will flights start being cancelled? Or will he extend the ban to the Caribbean? Will he extend to South America? It was unpredictable, especially with the current leadership that's in place in the US at the moment.
Yeah, of course. Yeah.
So obviously there was a bit of panic in the last couple of days when I was there, and some of my research didn't get to go ahead. Some of the interviews I had in those last few days were cancelled. So when I was flying home, I was lucky enough that the flight from Trinidad to Miami went ahead. And I have to be honest, everybody on board that flight was kind of afraid, terrified. Even when I was getting on the plane, I spoke to the air stewardess and I said, how is everything? And she was like, we're very worried.
Right.
Nobody really knew what was going to happen. But we made
Well,
it as
you
far.
would be on the plane because the air is always circulating the plane.
For sure,
So if
but
You did have it.
Sure, but at this time, it was the first couple of days of this thing.
Oh, it was only it was only still very new.
It was the middle of March, middle to end of March, just a couple of days after St. Patrick's Day.
Right.
So of course everybody was so concerned about this, and unsure. So we were lucky we got on the flight. When I was when I was leaving the airport in Trinidad, that was actually funny. They put on my boarding pass that I had to go through extra screening.
Okay.
And they were doing coronavirus screening, So some of the things that they did were they checked through my bags about 4 different times in the airport.
Oh, really?
I guess they were a bit worried that I was carrying it in my bag. I don't know. But no, I mean, at that stage, nobody really knew what they were doing. I mean, across the world. I can't blame them for that. But when we reached the US, then flying home, of course, that was quite hostile too. I think some of the customs and border authorities, maybe at that stage when the new regulations have been announced by the president, were unsure about how to apply it. So the second they saw my passport and saw that it was Irish passport from the European Union, they were kind of suspicious about why was I coming there,
Right,
So
okay.
they brought me into another room for screening, interview, and then they were, obviously checking to see whether I was allowed in. They interviewed me and asked, like, it says, I think it was at the time you couldn't enter the US if you'd been in Europe in the last 14 days, So they asked me questions about why was I in Trinidad, why was I there for so long, so skeptical.
Unbelievable.
So it was a bit interesting.
That's the US for you, really, isn't it?
It was interesting. I mean, being taken into a room and interviewed at these counters and all this stuff was a bit interesting. But got through that anyway. Got on the flight to London and got that far. And then my flight from London was cancelled. Didn't really know when. A lot of flights were being cancelled back then. This was at the time when a lot of companies were no longer doing the flights like normal. They were starting to cancel things. Everybody was unsure about how aviation would go in the future. So my flight was cancelled and the company provided me with a hotel. Now, one of the crucial mistakes I made maybe on the way home was that I wore a mask on the way home. And I'd worn it for a very long time, as you can imagine, to get from Trinidad to Miami to London. And when I got to London, I took off the mask.
Okay.
Now, obviously, masks stop me from spreading it to other people. That's been proven. But we don't really know how effective it is at stopping you from contracting. We don't know. But I kind of let my guard down a little bit when I got to London. Maybe because I was back in Europe, I felt I was getting closer to home. I felt that even if I can't get a flight to Sweden, I can always get a flight to Ireland, and that I felt like I was more secure.
Yeah, of course, yeah.
When you're traveling through the midst of a pandemic and it's the first couple of days, it's very hectic, right?
Yeah.
So I kind of let my guard down a little bit, I guess, in the hotel that day. I had my lunch and my dinner as usual in the hotel, and that was all paid for by the airline company and all this kind of stuff. But that was fine. I got a flight the next day, got out of London, got back, landed in Copenhagen, and took the train from Copenhagen 40 minutes away to where I live in Sweden. And that was fine. Everything was going okay. I felt great to be home, blah, blah. And about 2 days after coming back from the traveling, I started to become ill.
Right.
Now, it just started out with just like a blocked nose, something so simple, and a cough. Now, the cough was something else. The cough was really very dry, very loud cough. And just progressively, as the days went on, things began to get worse.
Right. And so since you weren't tested, are you able to say with certainty that you think you did have it, or is it kind of just it was around at the moment, so it's likely I did catch it?
Sure. So, well, as I say to you about testing, I requested a test. I called the number which you ring here for emergency advice and assistance. and they refused me a test. Their advice at the time was, well, they asked me for my symptoms, and I told them that I had this really dry cough, that my chest was very tight, which made it a little bit difficult to breathe, particularly at nighttime. Lying in bed at nighttime, it got quite hard to breathe. It became a challenge. It was nearly like you'd been hiking, I would say. That it was the breathing became affected. And then just little things like I could be sitting on the sofa here, and then I'd get up to brush my teeth, and by the time I get to brush my teeth, I'd be really tired doing that. Something so simple and easy. I was exhausted. I was wrecked from doing it.
Yeah.
So after this time, I felt like shit, and my biggest concern was my breathing at nighttime and the cough, this persistent cough throughout the day. But I rang them and they said to me like, oh, you're clearly sick, just stay at home. And they asked me for the symptoms. I gave them to them and they said, okay. And have you been in contact with anybody who had it? And I told them, look, I don't know. I've been in the Caribbean. I traveled home. Obviously, I had a lot of interviews. I met with lots of people in Trinidad. And I mean, flying on planes with like hundreds of people on board and staying in a hotel. It's impossible to know where it worked, though.
Yeah,
but
of course.
What he said to me was that he said, okay, we will not test you. You will not be tested. You are sick. When you are sick, you stay at home. You do not come out until you are better. You need to wait 14 days. And then after that, well, no, he didn't say, my apologies. He said that you are sick, you need to stay at home, and you need to wait at least 2 days after the symptoms have gone until you are allowed to go out. So I again, like, I requested the test. I said, look, given that I've been traveling and all of these things, and given that I feel so bad, I really would like to test. He said what the medical advisor told me at the time was that, look, you have the symptoms of this thing. It is very likely that you have it because you have been traveling. You don't need to be tested. If you have a chest infection and you come to the hospital, come to the doctor, we don't need to test you for a chest infection. We can diagnose you based on your symptoms.
Right.
And he's like, if it makes you feel better, we can say that your diagnosis is that you have COVID-19. It's very likely that based on the symptoms that you have, we can diagnose you with COVID-19. He said that
that's actually a very interesting approach.
That was the approach they followed, and he told me that if I became more ill, that I could then come to the hospital if I required hospitalization, and that then I would be tested. But until it got to that stage, I needed to stay at home and rest.
So they were just treating it as it was just a normal illness, rather than just being.
That has been the approach here. The approach here has been, if you are sick in any way, stay at home.
Yeah.
You don't have to stay at home if you're well, but if you are sick, stay at home. When you go on a train or you go on a bus here, they have televisions which give you like the latest news all the time. That's always since I've been here. They give the latest news, or maybe it'll have advertisements of like things to do in nearby towns and cities. And also on the little TV screen, it'll tell you when your next stop is coming up, and you press the button or whatever. But one of the messages that's always on the screen now is like, wash your hands, constantly wash your hands for 30 seconds.
Yeah.
Stay at home if you feel ill. Like, these are the steps that have been advised. So that was what they told me. They told me that you are sick. Because you are sick, you need to stay at home. If you get worse, you can come to the hospital. You don't need to be tested. You have the symptoms. Just stay at home and rest. That was the advice.
Now, as much as myself and yourself may praise or agree with the Swedish approach, I know they're only doing testing in situations where you need the hospital care.
Mm-hmm.
But all that, we just leave that all behind us.
Hospital care and medical staff.
medical staff, yeah.
Mm-hmm.
Now, just leaving that all behind us, what's the approach like towards, the Black Lives Matter protest? And because obviously it's such a large public gathering. So
Mm-hmm.
obviously in places like Ireland and America and even the UK again. I know I keep bringing up those three, but
Mm-hmm.
they're really the three biggest countries
Mm-hmm.
when it comes to stuff like this. They are all concerned about a second wave happening
Mm-hmm.
because everyone is gathering again and there's no social distancing. Now you touched on earlier that the Swedes are very isolated. They've already been doing social distancing for as
Mm-hmm.
long as you've been there.
Mm-hmm.
So with these protests happening, are they still doing social distancing, or are they just all kind of bundling into one and no face masks, no gloves?
Um, it's a good question. So from an official perspective,
Yeah.
the limit here on gatherings has been 50 persons. You're
Okay.
according to the regulations, you're not supposed to meet in groups of over 50 people.
For anything.
No,
Right.
50 is the maximum number for gatherings.
Okay.
Now, is that being enforced? That's a little bit questionable, I say, because a lot of bars do have full seating area outdoors, and indoors are quite busy as well. So uh, whether the 50 is a really binding 50, I'm not so sure.
Yeah.
But I know that there have been Black Lives Matter gatherings and demonstrations in Stockholm, the capital city, in
Yeah.
Malmö, which is a very nearby city to me, and even in the city that I'm living in Lund, there's a gathering this weekend as well.
Yeah.
Now, I know that the organizers of these events were collaborating and coordinating with the police, and also collaborating and coordinating with the Public Health Agency, looking for advice on what steps would need to be taken to be in compliance with the guidance and recommendations.
Yeah.
And I can say that I wasn't in attendance at the one in Malmo, but I know that they did seek advice on how best to handle it. And I believe that on their event, what they advised people to do was to wear a mask and
Right.
to try and keep a bit of a distance if they could. But to be honest, I would say that with regards to social distancing,
Yeah.
spatially, from a spatial perspective, that has not really been practiced in Sweden. When I say people are socially distant, I mean that they don't engage with you if they don't know you, they don't come up. But like I could say, for example, that all of my friends, when we've had barbecues or going away parties for people who've been leaving or whatever, of course we've been hugging each other and shaking hands and
Yeah.
sitting
Of
and
course. Yeah.
sitting
Yeah.
normally and eating food together and all these different things. Going, but so have all of the people who've been living here really. And so even in supermarkets, for example, it's kind of funny. The supermarkets often have these markers on the ground of like what's a 1.5 meter distance. They usually have
Yeah.
the spaces that are 1.5 meter distance. But to be honest, nobody's following.
Right. Okay.
Nobody, the people are just, I mean, they're just on the ground. They're not being followed.
Yeah.
Um,
People will always be people. Yeah.
I mean, the only places I can think of which have been doing any form of COVID management really are some restaurants. If they have a table, one table here, one table here, one table here, one table here, every second table they'll put like yellow and black tape on it and put an X on it so you can't sit there.
Yeah.
Or they might do. I mean, we have in Sweden. There's no off licenses in Sweden.
Oh, right. Okay.
And in the supermarkets here, you cannot buy alcohol that's over like 3% alcohol volume.
Oh,
Um,
really?
the only place that you can buy from is something called a Systembolaget. And Systembolaget is like a government-run off license. And we have Systembolagets in every city, town, village of Sweden.
Yeah.
But it's an approach that's to try and regulate drink, So
Right.
you cannot do drink promotions, buy 2 for 1 or blah 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 for €15. It's like, this is the price. It's extremely regulated. This is the only store which sells this in the entire country, and that's the way it is. And
And what's their culture like around alcohol?
uh,
Obviously, it wouldn't be like back home.
it depends. I mean, people here, when they drink, they have fun, and
Yeah.
they're less socially distant. So, I mean, people here do like going to bars. That's a big thing. But in terms of drinking from home, you have to go to the Systembolaget to be able to buy alcohol. Or you can shop at your supermarket and you can buy alcohol-free options, or you can buy any beer or something that's under 3%.
Right.
Um, but in these Systembolagets, I know that they have been enforcing um, a level of social distancing by only allowing a certain number of people to be in their store.
Yeah,
Uh,
it's been like that here as well. Almost every store now is turned into a one-way system,
mhm.
and there's only a certain amount of people in at each time.
Yeah, but
So it is
it's a
kind of a
bit
culture shock almost.
it's a bit counterproductive here, because if you were trying to get into the Systembolaget where you could buy the alcohol, and they say,
Yeah.
okay, maybe 50 people or 40 people allowed in at a time, and they're kind of estimating how many are in and out, and one person stands at the entrance, counts, and one person stands at the, like, two people collaborating on numbers before
Yeah.
they let you in. Of course, it means that a very large queue of people grow to try and get in,
Yeah.
and people are not at a distance of 1.5 meters. People are just at normal standing distance.
Yeah. I was even reading there the other day, a supermarket in LA, or well, California anyway.
Mm.
Um, they had, I think they were under curfew. The curfew was 6 p.m.
Mm.
and it was 4:30 at the time, and then the governor changed the curfew to 5 p.m.
Mm-hmm.
Um, so although it's like 4:30, they have this one-way system. Everyone is queuing up, and then they get wind that the curfew is going to be implemented in half an hour. So although everyone is outside and there's people inside, they don't tell anyone to go home. They just
Mm.
let everyone come back in.
Yeah.
So although everyone is socially distancing in the
Mm-hmm.
queue, um, once you know that you only have half an hour, it's like that's
Mm-hmm.
kind of out the window. And it's like there was no point really to begin with if this was going to
Mm-hmm.
be the end result.
Mm-hmm.
So it is. I think it's really a weird situation that I think we find ourselves in, because we have countries like Sweden doing their approach, and then we have other countries criticizing their approach. But just
Mm-hmm.
from talking to you, it would seem that it would be more logical for the majority of countries to do a Swedish approach, in my opinion.
Well,
Um,
I
because
would
I
say,
mean,
yeah, go ahead.
well, I mean, knowing what we know now, I know I said earlier, hindsight is 2020.
Mm.
It does appear that this virus is really only affecting people that A, have pre-existing conditions, or B, are over the age of between, say, 55 to 70.
Mm.
So with that in mind now, it should be a thing where, looking back, we should realize that shutting down the economy was a mistake. We could have done it, say, we could have shut it down, say, 30% or 40% or even 20, and
Mm-hmm.
just advised the people who are at risk to cocoon, or to track their movements, or only do essential trips.
Mm-hmm.
But just shutting it down for everyone completely, I think that's where the issue lies. And I think in part as well, that's part of the reason why all these riots and chaos is taking place in America.
Mm-hmm.
Because I think, what was it? I think it was something ridiculous. I think it was like 40% or 50%. It was something ridiculous of the amount of people who signed on to unemployment.
Mm-hmm.
And then they're told for the last 10 to 13 weeks, you cannot come outside.
Mm-hmm.
So now all these riots are happening, and people just have this distrust in the media and the government. So I think, I'll say it again, hindsight is 2020. So I
Mm-hmm.
think if we knew if we knew now or if we knew then what we knew now, I think it would make sense for the majority of places to apply a Swedish approach, and I think
Mm-hmm.
it would be mostly under control for the main part.
Mm. Well, I mean, look, I mean, what we can say is that, I mean, the Swedish approach might not work everywhere, but
Yeah,
certainly
of
not,
course. Right.
certainly neither does a lockdown, which is what a lot of
Yeah,
people have been communicating.
yeah,
And I mean, look, I mean, what I would say about it is that Sweden's approach has not been perfect because, although, as we say, that the death rate of the death rate here for people, 90% of those who've died have been over the age of 70. Um,
yeah,
a big issue in this country has been a large number of those deaths have occurred in elderly care homes, old folks' homes.
yeah, of course.
And that's what the chief epidemiologist has said has been one of the measures that he would have looked at differently, as if he could go back in time and apply the approach again, would be to
Yeah,
deal with that differently. That maybe there could have been action taken better there. Now
yeah,
there has been a national ban here on people visiting the elderly homes, but that did come in later. So that's something that needs to be worked on because, of course, the society, the government has an obligation to protect those who are older. We can't just disregard their right to life too. We have to try as best we can to
yeah, of course. Yeah,
protect them as well. So Sweden does need to work on that. Sweden needs to maybe review how that went and apply a different approach if there were to be a pandemic similar to this in the future.
yeah,
Um, but I think you touch on something quite interesting, which is uh, about the economy.
yeah,
Now, of course, Sweden's economy is still going to take a hit because each and every economy in the world is interconnected. You know, when
right.
when Wall Street collapsed, the whole world collapsed. Uh, there's obviously an over like a connection between the two.
Yeah.
Um, But according to the Swedish finance minister, they've said they've projected that the economy in Sweden will shrink by only 7% in 2020. Only
Oh, really?
7%.
Okay.
So
Okay.
that is quite, of course, it's a shrinkage in the economy, which is a bad thing, but it's only 7% if those projections are
Yeah.
actually realized. Now, what I would say about the economy as well is that uh, it's very interesting to me how countries and governments who seem to care about the economy have suddenly shut down their economy. I kind of sometimes wonder what advice were they getting
Yeah.
to tell them to do something like this, because uh, if people are, I mean, you and I know it well from growing up in Waterford the last time that there was an economic collapse. Um, people were people were throwing themselves off the bridge in Waterford into the
Yeah.
river shore because their life had become so bleak. There was no job opportunity. The mortgage couldn't be paid. The rent couldn't be paid. The husband or wife had just left them. Chaos
Yeah.
as a result of a wrecked economy. And uh, whether we like it or not, it's very important that uh, people have jobs. Now,
Yeah. Of course.
how you get those jobs, whether it's through a socialist or a capitalist model, is a different question. But people do need jobs in their life to live. People need
Yeah.
enough money to survive. And while there's conversations about guaranteeing a basic income, the fact is that in the world that we're living in right now, people need a job to have enough money to live a sustainable life.
Yeah.
And when people don't have jobs, life can become much more limited. What people can do, where people can travel, what people can buy. Uh,
Yeah.
you know, so let's say this that by shutting down an economy for 3 to 4 months, putting every single pub worker out of a job, putting every single restaurateur, hotelier out of a job, shutting down every public sector service, reducing the amount of bus drivers getting hours and pay. It may actually be all right for a country like ours in Ireland, where the economy functions quite well. But imagine in other countries where there's no such social security system.
Yeah.
And
Yeah. Like I mean.
I've even been seeing that the government have announced that they will be changing the unemployment benefit from COVID in June or July. That those who were earning below, I think it was €200 a week, will be getting the standard payment of
Yeah.
unemployment.
That's correct. Yeah. Yeah. No, even just touching on what you're saying there,
Mm,
you know, the importance of people having jobs and education. You know, although it might be okay to kind of put a pause on it in Ireland and Sweden, if we just look at America quickly,
mm,
you could say that prior to all this, college graduates over there were starting their life on the back foot anyway,
mm-hmm,
with just immeasurable amounts of debt.
mm-hmm.
So now, if they're graduating from college now, um, you know, they're really, really in a spot of bother with all the debt
Absolutely.
and,
Mm-hmm.
you know, zero to next to none, or sorry, next to zero job opportunities.
Mm-hmm. Absolutely,
Um,
absolutely. I mean, even just in terms of my year and everybody who just graduated, I mean, it's going to be incredibly difficult for us to find a job, even in Sweden or in the EU, where the economy has maybe not been hit as hard as the United States.
yeah,
It's always quite interesting to me that it seems like the cost of economic crises seems to always be borne the hardest by the poorest
yeah,
society, whether it is students who may be um, educationally very wealthy in
yeah,
knowledge, but financially broke as hell. Uh, they carry a lot of that burden. Working in middle class families carry a lot of the burden during an economic crisis. But
yeah,
life goes on as normal for the very well off. I mean, they can still afford to go to the races and get thousands and thousands of euros and have seats in the VIP lounges and drink endless amounts of champagne and beer.
yeah,
They'll be fine. They'll just do fine. But I mean, it's my hope that an economic crisis uh, doesn't occur as a result of the pandemic. And even if we say that what we're currently going through right now is an economic crisis, hopefully it'll be short because I can't imagine the amount of deaths, the amount of self harm, and the amount of injuries and mental injuries and scars which would occur as a result of another economic collapse.
yeah. So just based off what you're saying there, would you disagree with the talking point of a global recession that's coming?
I think it's a possibility. Um, I think that
But
we
it
might
won't
have.
be
I think we might have been heading that way anyway.
right.
But I think what will decide, in my opinion, what will decide whether an economic collapse happens or not are the decisions which occur in the aftermath of this pandemic. So when the economy reopens in all these countries, as long as there's no second wave, if there's a second wave, absolutely there'll be an economic collapse. But if
Right.
there is no second wave, what will decide, in my opinion, whether an economic collapse will happen or not is the response of consumers in the aftermath of this. Will people decide that they want to go out to restaurants again after this virus, or will they decide, I'm not taking the risk, I'm just going to go home?
Yeah, yeah.
Will
But
people
see,
decide? Will people decide I'm
there
no
will be.
longer? Or will people decide I'm no longer going to Greece for my holidays, or I'm not going to Canada or the US or Australia? I'm just going to stay at home. I'm not going to take the risk. If people go about things in that way, which is perhaps a more sustainable way, funnily enough, and maybe better for the environment, funnily enough. But if those types of steps happen, if consumers decide that, nah, I don't really want to buy this kind of product anymore, I don't really want to change that anymore. Uh, of course, there's a knock-on effect for those industries where people are put out of work. And I guess one of the ways to ensure that a global recession doesn't happen, which is quite unique actually, is that perhaps people need to start investing more in their own local economies. You know, if you live in Waterford, instead of going on holidays to New Zealand, instead you might say, I'm actually going to go and spend 3 weeks in Wicklow, or I'm going to go and spend 3 weeks in Galway, in Salt Hill, in Kerry.
Yeah,
I'm
yeah.
going to explore my own home. I'm going my own country. I'm going to invest the money that I have earned in local hotels, local business, local tourism. That might be
Mm.
the only way of avoiding recession here. If people decide, we're going to invest in our own local economies.
And that is something I've been thinking about much more recently because, you know, I can admit that I have probably traveled more outside of Ireland than inside of Ireland. I think the
Me
only real
too.
travel,
Me too.
I think the only real travel I did in Ireland is just going to Dublin Airport. Um,
Get out.
but yeah, to get out. But no, especially during the lockdown, it has kind of shined a new light on that, because especially with me, I do plan to still move abroad. But with that in mind, I have been recently more interested in, seeing more of Ireland for really to experience it the way, say, an American who would come here would
Exactly.
experience.
Exactly. Even for example, in the last like 2 weeks, friends of mine, if we've gone traveling, we've gone to Helsingborg, another city, or we've gone to
Right.
Malmo, or we've gone nearby to some of the beaches that are only maybe 10 to 15 kilometers away, all by
Yeah.
bus or train. We've taken these trips. Or we've gone and cycled to the nearest village, like 5 kilometers away. And my friends and I mean, it's never something we've really discussed, but I could certainly say that we've been much more willing to spend money locally.
Yeah.
Because there's kind of a feeling amongst many people here to try and like keep the businesses alive. That a lot of these businesses, even if the economy is open, a lot of businesses have suffered in Sweden.
Yeah.
As I could say, based on that 7% projection in the contrast, the reduction in the size of the economy. I mean, the economy still is hurting here. But certainly I could say that we've taken these trips, we've used the transport, and we've gone to local restaurants in these different areas. And I do wonder, will that be something that more people do in future, where people really travel more in their home areas?
It's even like that with the local economy here in Tramore. For the businesses that are still open or that have only opened recently, there has been a lot of support going back into these businesses. Now as well, unfortunately, some local businesses have closed down permanently, but I suppose that's expected everywhere. But it's nice to see. There's been I don't know about, well, I know Sweden's a cashless society,
Yes.
but here in Tramore there's been a lot of businesses that would only take cash. And as someone who works, I never have cash because it's just paid straight into my account. So it's actually been quite refreshing to see that some of these businesses are now adopting card machines. Because obviously we know that the virus can be carried on cash and whatnot, but it is nice to see that they are taking more modern approaches to remain open, whereas before they would have been kind of stuck in their traditional ways.
Sure. I mean, look, of course, this is going to have a devastating effect for businesses.
Yeah.
It's already had a devastating effect for people. People have been unable, in different parts of the world, people have been unable to attend the funeral of a loved one or a friend, or people have been unable to go and get married, or people have been unable to do all the things that they had planned or dreamed of, traveling to another country, starting a new job. All of these things have been put on hold or cancelled or have been missed. And as you say about businesses closing down, even here locally, I've seen businesses close down.
Yeah.
I can think of one, for example, that was a new kind of restaurant, bar, nightclub thing. It only set up maybe 6 months ago, and they decided to close it because they said, we're losing money. It couldn't happen for a new business. We couldn't survive. And that's sad and evident. But it's also a time for new opportunities too, actually, at the end of this.
Right.
I think that with the difference that this virus may be making on people's lives, there are new opportunities for innovative entrepreneurs or people to come up with a new idea, or come up with a new pastime for people, or a new hobby, new business idea, whatever it may be, that could actually work in whatever the aftermath of this virus actually looks like.
Yeah, and even with these the new innovations that you speak of, I actually just came across a company today called Intellect, and they have a website and an app, and they started trading last year, but their business only kind of became viral in the lockdown, and what they're doing is on the app and the website, they offer free sessions with, I don't want to say with a psychologist, but there's things you can do yourself. You can guide yourself through these sessions if you have any sort of mental health issues, or if you feel a bit sad, or if you have depression or whatever. Because obviously we know that going to these psychiatrists or going to these counselors can be very costly. So for something like this to come out that isn't going to be as costly or the same cost, is obviously very helpful, because there's a lot of people that suffer in silence, or they're not financially stable, so they might put their mental health on the back burner. And then obviously living in this kind of lockdown and with all these restrictions, it's gonna, usually you might be able to push all these feelings to the back of your head, but when your job is taken away from you, when you're worried about rent, when you're worried about food, you can't see your friends, you can't socialize, all these things are going to come back to the front of your head. So it's nice that those people can have this as an outlet to help live with these issues, or help kind of get them out of their head, versus going to an expensive psychiatrist, which I think they can be up to $250 to $300 per session. Obviously they might be a bit more if it's a longer session, but still, I mean, if you need to see someone once a week and it's $200, $250, that's probably the majority of your weekly paycheck. And then you have rent, food, electricity, whatever else. So I suppose for them to offer this service the way they're doing it, without the lockdown, it might not be this way, or it might not be available. So I suppose we can take benefits from being in a lockdown, and we can. I think we should view it as the glass is half full, not half empty. But that would just be my opinion on the lockdown. I like to look at things as half full rather than half empty. But of course, I do understand some people are struggling immensely.
But perhaps it also needs to be looked at like this: that we should of course take different steps to ensure that that mental health is something that we deal with in our own lives, and it can be dealt with in a holistic manner. It can be dealt with through exercise. It can be dealt with through social contact. All of these different ways. And I guess this lockdown might actually make other people more conscious of their mental health in a way that maybe they never have been before, or people may be suffering in a way that they never have before. And for those who have pre-existing mental health issues, I guess this exacerbates that and makes it even worse being in a lockdown and isolation. But maybe it also needs to be a time to have a conversation about how we change the way that we tackle mental health. And I'll give you an interesting example just from having a conversation with a friend of mine the other day, is that if you look back at your time in primary school, or even your time in secondary school, can you ever recall a time when a nurse or a doctor visited the school, or where you visited a nurse or doctor through the school to get things like vaccination, eye tests, your height being measured?
Yeah. There was only one time in second year we all had to get some sort of shot. I can't remember what it was for, but the whole school had to get this shot.
Sure.
But besides that, never.
Never. But in primary school, you recall eye tests, height measurements, all this kind of thing.
Oh yeah, of course.
Vaccines, right. So that's dealing with your physical health. Now, do you ever remember a time when a doctor or a nurse who focused mainly on mental health, aka a psychiatrist or a psychologist, ever came to the school in primary school?
Not in primary school, but I think in first or second year again, they organized, and it was quite poor. It was only like a 20 or 30-minute talk on online bullying.
Okay.
But that was it.
Okay, so and then in the rest of those years in a high school setting, nothing. So maybe if we were really to try and tackle our physical health and mental health in an equal way or a
Yeah.
more equal way, it would include something as simple as psychologists or psychiatrists who are well trained to interact with children, coming in and meeting them and having chats with them the same way that nurses and doctors come in and give vaccines and measure height, check eyes, you know?
Yeah.
Something as simple as that. And then as that child grows up through life, it can continue into high school as well. And that every single student goes through it, every single one. And that as time goes on, because you've been interacting with a child psychologist or psychiatrist that everybody, since they were a child, it becomes less stigmatized as we get older, the same way as visiting a nurse or a doctor becomes less stigmatized because we're used to visiting them in school from our memory. Even as babies, obviously, we attend to them, but don't recall. But of course, we all remember as children going and getting our eyes checked and seeing the board which has A, E, blah, 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 until it gets really tiny at the end, or getting our height measured, or getting our vaccinations. And that's a very simple step that could be taken if we wanted to address it. And, I mean, as much as we have like organizations that do good work, like Pieta House and organizations such as that, I think we also have to put more pressure on our government and our authorities because it is their primary responsibility to safeguard our rights, such as our right to health, which includes mental health. And yes, organizations like that are necessary as like a short-term measure to reduce the stress and ensure that people have somebody to go to. I still think that we need to have a conversation as well about pressing for better, I mean, as you said, about 250 or 300 euros to attend a psychologist or psychiatrist. That is really unacceptable.
It is. Yes.
If somebody is in need of health care, which this is, health care, if we live in a decent society that protects everybody's health, it should include their mental health. So, I mean, as outrageous as it is that people have to pay 50 euros for a GP visit, or 55 euros, or whatever the case may be, 45 euros, and that is itself too much. That is really too much to be paying, I think.
It is,
To pay 250 or 300 euros for a service for your health, just like a GP visit, is really, really wrong. So that's something we should demand better for.
And I would think as well, in relation to, paying, let's say, 300 upwards, or between 250 and 300 just for this visit, because it's costing you so much, I think you'd almost feel like it's not as genuine. It's like this person is just here to make a living because they're charging such a premium. But if it was subsidized by the government, or if it was available through a medical card, I think you might be able to have that more personal touch or personal reaction.
And then this is the question as well, then, is that shouldn't, even if you want to ensure that this service is available for all people, that's a very good way to do it. But even if you want to ensure that the poorest and the middle class are able to go and get their health checked, and that wealthier people who maybe can afford to pay the 250 to 300 should, that's still a better step than the way things currently are of it being so expensive.
Of course,
And it makes me go back on something too. Is that okay? Imagine somebody decides, my health is so bad, my mental health is so bad that I actually do need to go for these 250 to 300 euro visits twice a month, or whatever the case may be. If somebody decides to do that, and they are a low to middle income person, and they invest all of this money from their income into addressing their mental health, it could actually result in their physical health getting worse if they don't have enough money to buy food.
Of course, yeah.
So there's a big trade-off.
Yeah.
Or if they don't have the money to join their local fitness club, and I mean, all of these different things, or instead of eating fresh foods, that they're eating processed meals, This is all part of it.
That's another thing with the lockdown as well. We have seen an increase in the amount of people that are eating like these ready-to-go meals or these microwavable dinners.
Mm.
Now, to be honest with you, I don't know why the lockdown would make someone's thinking of food change.
Mm.
Um, because the government told me I can't go outside. When I do go to the shop, why would that make me buy a dinner I can eat up in 2 minutes?
Mm.
Like
I didn't
the
know about
cooking
this phenomenon.
the cooking shouldn't change.
Mm.
If anything, because most people aren't working now, I would I would, because, well, maybe it's easy for me to say because I have a love and passion for cooking, so it's something I'm interested in. But I would
Mm.
always want to encourage someone to cook food, and with more free time on your hands now, I think now is the perfect time to actually try cooking and try fresh and natural ingredients rather
Mm.
than going up and buying some burger you throw in the microwave for 2 minutes and then you eat it and 40 minutes later, oh, I'm fucking starving.
Mm.
Um, but if you actually set out, so I don't understand this. First it was everyone's buying toilet paper, and then it
Mm.
became everyone is buying this crap food. Every time I go to Tesco, it is full of fresh food. It's full of fresh veg and
Mm.
fruit, and
Mm.
then you see the processed food, the microwave food. It's impossible to get your hands on that.
Oh, really?
It's like this food is now becoming the toilet paper. It was impossible to get toilet paper,
Mm.
and now it's impossible to get, these cheap crap burgers, these hot dogs, these microwave lasagnas,
Mm.
all that crap. But you
Mm.
could, and what makes no sense is if you're buying a week's worth of dinner
Mm.
and it's all microwavable, it's
Mm.
probably going to cost you more. So let's say
Mm.
you bought, let's say you're one of these people who eat the same meal every week, and you just
Mm.
buy 7 microwave lasagnas.
Mm.
That you're probably going to spend more money total that week than if you were to make one lasagna from scratch that would last you the 7 days.
Mm. Yeah, I had no idea about this phenomenon. I never heard of it. But
It's crazy. I don't understand
well, look, I
why.
mean, let me say this about it, right? Um, I think it could also be partly linked to a lack of productivity. So if people are becoming less and less and less productive, if people are achieving less and less and less each day, then people become less productive. People want things to be just more and more and more
Yeah,
and more easy. So putting something in the microwave for 2 minutes, that's pretty easy. And
it's
it's
just
that,
like instant gratification.
but it demonstrates a decline in productivity in the society generally.
Mm.
But what I'll say about processed meals is that everything in balance, everything
Yeah,
in
of course.
balance.
Yeah,
So, for example, if you have one of them a week, that's fine. I mean,
yeah,
sometimes I
exactly. Yeah,
have sometimes I have the lasagna I put in the oven. I usually do it because there might be a day where I'm really busy studying or I'm really
yeah,
busy.
of course. Yeah,
I've got things I've got going on. But generally speaking, isn't it better to buy raw meats, raw fish, these
yeah.
kind of meals? Um,
And
and
as well, I think a lot of people have this misconception about eating healthy. They think they
mm,
have to cut out everything. You
mm,
don't. You
mm,
can, like, let's say, for instance, you're one of these people who eat these processed meals 7 days a week,
mm,
and then you realize, oh, I need to eat healthy, I need to change.
mm,
You're going to think, I have to cut out this completely.
mm,
Well, if you go with cold turkey and do it,
mm,
the success rate is very low.
mm,
Um, I think it's important that these people do slow cutbacks. So maybe
mm,
from 7 times a week, they could even just start with doing it 6 times a week and then cooking once a
mm,
week.
mm.
But then once you get in that routine, then you can have your processed lasagna once or even twice a week in
Yeah,
moderation.
agreed,
But there's
agreed.
no need to do these extreme cutbacks
Mm.
because it's only going to last a few days and
But
then you're going to fall back in.
it's the little measures that count, and even in terms of, even if it doesn't save much money, it's also for your health. So, for
Yeah,
example, one I could give you is that I do myself, which could be helpful for other people too, is to, instead of buying juice in the supermarket or buying smoothies in the supermarket, which are loaded in sugar, you
yeah,
want to you want to buy innocent smoothie or Tropicana juice or whatever. It's loaded in sugar. The better thing to do is buy the fruit fresh and put it in a blender or a squeezer and make
yeah, of course. And it's actually, I find when you do that, it's actually much nicer.
Yeah, I do too. So, for
especially the
example,
orange juice.
what I had this morning, and it sounds so exotic and blah blah blah. I had dragon fruit, I had watermelon, and I had avocado. I put it in with
That
some
sounds
milk.
lovely.
Put it in with some milk. You blend it. You get a smoothie. Now, how much did that cost me? Hmm? When I buy all of my groceries from the markets that I go to buy fruit and veg, if I buy all of my fruit, maybe I buy some strawberries, I buy some watermelon, and remember, Sweden is expensive.
Yeah,
Strawberries, watermelon, maybe I buy pineapple, whatever I buy, maybe dragon fruit, banana, apples, whatever it is. And I buy some vegetables as well, spring onion, garlic, maybe some broccoli as well, some corn on the cob or whatever. Um, it might cost me for the entire week my fruit and vegetables maybe €20, maybe less,
right.
15 to €20.
That's
Now,
okay.
but you tell, and that's expensive, I guess, because Sweden's expensive. But now you tell me, if you're
I think that's
somebody,
okay.
but say 15 to €20. Now tell me you're somebody who buys an innocent smoothie or a Tropicana or one of these or Ribena or whatever it is. They're usually €3.50 or 4 euros.
Yeah,
They
yeah.
are usually around there. And imagine then you see a deal that's, oh, they do 2 for €6 on this. I'm gonna get that.
Mm,
Okay, that's €6. And then say you buy other things like say you buy say you buy 3 cartons of juice that week. That's €9.
yeah.
€9. Now compare that to my 15 or 20, which is all fresh. All fresh.
Mm,
And as I say, that's fruit and vegetables. Let's take out the price of the vegetables. It probably works out nearly the same as what you paid for the smoothie for the week.
right.
And that's loaded in sugar.
It
So
is. Yeah.
there's little steps that people can take to make their life more healthy and boost their immune system. You can do
Yeah.
things like you can take a vitamin D tablet. That's always very helpful.
Mm,
Cod liver oil is helpful as well, but
yeah, they're very good as well. Yeah.
a D vitamin is a very good one to take.
Mm.
If you are somebody suffering with depression or anxiety, I think they also recommend that you take B12.
Oh, really?
B12 and D together.
Right. Okay.
That's what
And
they recommend.
that's the thing as well. I don't know many people. Like, I don't know about you over in Sweden, but I myself don't know many people that are kind of big into these vitamins or these supplements. I know myself. I take vitamin D and fish oil.
Me
Um,
too.
but that would be about it for me. I would like to take a few more, but for
Mm.
now they seem to be doing the trick. But I besides that, I still, I'm not aware anyway of many people that would be, conscious of these vitamins or, as you're saying, buying fresh fruit and fresh veg,
Mm.
especially in the lockdown.
Mm.
It just seems like everyone, as you said, is being less productive, and I suppose in some cases it might be okay if, before the lockdown you were extremely productive and now you feel like, I'm going to relax.
Mm.
Fair enough. But I don't think that's the case for the majority of people.
Mm.
I think the majority of people found themselves in a rut going to a job they hate and
Mm.
then coming home and, eating food for pleasure or to forget or whatever. And
Mm.
now they don't have that rut to go to. And now all they do is just eat food for pleasure. Um, and they're just sitting at home on Netflix
Mm.
without taking the vitamins or without, buying healthy food.
Mm.
Um, so I do think there is, as you said, it is something that the small steps that people could do to maintain a healthy lifestyle.
And
Um,
you know something that um, when I was living back home, I never really observed it. I never really observed it, and I guess it may not have been something that was very prevalent in my family, but I wouldn't have ever really noticed it in other families. And as I've gotten to see other places and be other places and stuff, I think one thing that we really need to work on back home that we can do together is we really need to work on developing a better food culture. I think
yeah.
that I think part of the problem here is that Irish food isn't very good or very popular.
Mm,
It's not very tasty. We don't use many spices. We don't use many herbs. So the food is quite bland.
yeah.
Um, And then I think a lot of younger people want to get the hell away from that. So instead, they buy takeaway or processed meals.
Yeah.
Um, and
Now,
that,
just to segue
sure.
from that, I don't have the numbers for Ireland, unfortunately, but I do have them for the state of Omaha and Hawaii. I don't know if you watched that Joe Rogan podcast with Joe Salatin, but he was talking about there's only 10% of the food in Hawaii is produced in Hawaii, and then I think he said it was 5 or 10% again for Omaha, and then he used those two states in his example because both, or no, sorry, Idaho, I think, both Idaho and Hawaii would be extremely rich to grow food and produce food, yet they just send all their food away. And I don't have the numbers for Ireland, but I wouldn't be surprised if Ireland was doing the same thing. Because I know Irish meat is so popular. But I wouldn't be surprised if, look, I know you said the Irish food is bland, there's not much seasoning or whatever. But the fact that we do have decent landscape here for growing and producing food, it's a shame when you see a state or a city or a country ship the majority of that good local produce away and then import. I suppose they can import similar produce in quality, but it would just be nicer if you knew exactly that you were supporting your local farmer or your local tomato grower or whatever.
But I think that that's something we'll have to work on, about developing a better food culture with our local produce. I think that that's something key, because at the moment, from the rates I can see here from the irishheart.ie, they say that 24% of adults between the age of 18 to 64 in Ireland are obese.
Wow.
So that's 1 in every 4 people. And another one says here about like the this is from the Irish Times. I mean, I'm only getting it off my phone, but maybe you can see the chart here about the direction it's going in. But it says here that, like, according to the projections and the way things have been going from 1980 onwards, that in the 2020s on, the obesity rate is looking like it's going to hit over 40%.
In Ireland?
Yes.
Wow.
So this is something we're going to have to work on. I mean, obviously, since the 1980s, our economy has gotten better and people have more money in their pockets and stuff. But it also seems to show that the rate of obesity is increasing too. And that's so interesting, because often we associate, like, oh, as long as you have more money, you have better health. Because when you're poor, you're starving. And that's often true. But obesity is also a food health crisis too, which is bad for your health. So I have to tell you, I'm actually quite concerned when I think about it back home about the way people eat. It's quite concerning. People often eat just like a lot of processed meals, or they eat a lot of what kind of other things, like chicken goujons all the time.
Well, even the other day, the McDonald's in Waterford opened.
I saw this. Yeah.
And the queues were just phenomenal, just for McDonald's. And I think for loads of people to think, oh, look at me, I can get McDonald's today. Like, oh, so what? It's crap food, and it's not good for you. It's not something to celebrate.
I feel like our country has become quite Americanized.
It has, yeah.
It's slowly but surely becoming more American.
We have Krispy Kreme donuts and Five Guys burgers up in Dublin. They're probably 2 of the biggest fast food chains in America, in their industry, donuts and burgers. But to see them opening in Dublin, they're probably going to slowly start opening in other spots. Maybe Galway, Cork, Waterford. And look, there's probably nothing wrong with that. It creates jobs and whatever. But the problem is people are going to abuse it.
Yeah, exactly.
No balance. It's always there. Yeah. Oh, there's no food in the house, I'll go there. And then they eat their food there. So they come home, they're not hungry, so they're not motivated to buy food for the next day. And then they just end up in this cycle, and it continues and continues.
And it's not like, it's, again, you know, I mean, if you want to go out and eat in a restaurant or whatever, that's fine, that's cool. But
Yeah.
try and make it something that is kind of a little bit balanced as well.
Yeah, no, look, I'm not criticizing anyone for
Hmm.
eating McDonald's or these takeaways. We all do it.
You shouldn't
But
be
what I'm
fat shaming.
well, that's actually, we can get into that on the next one. Actually, I have a lot to say about that.
Hmm.
But what I'm saying is, with these takeaways, is look, everyone is going to eat a takeaway, but
Sure.
just don't fall into a cycle of eating it twice a week, 3 times a week. You know, try to keep it at maybe one time a week.
Yes.
Um, you know, look, we all go to McDonald's. We've all been to the, Five
Burger
Guys or
King.
similar, Burger King,
Hmm.
KFC.
Hmm.
You know, it's ingrained in our culture that these fast food giants are probably always going to be there.
Hmm.
So there is no escaping them. So if
Hmm.
you are going to choose to eat there, just know what you're eating. And I suppose I'd have more confidence in an Irish McDonald's versus an American McDonald's, because
Yeah, of
even
course.
again on the Joe Salatin podcast with Joe
I
Rogan,
saw
right?
this. I saw this about the amount of
He,
different meats in the burger,
Yes, 600 animals in a fast food burger.
on
Imagine that.
average,
That's just disgusting.
in the
So
US.
in the US, yeah. So I suppose we're lucky in a way that the Irish McDonald's do use Irish beef.
Mm.
Um, and I've even had McDonald's in America before, and it just wasn't the same. Even the
Mm.
milkshakes, it's
Mm.
not the same. I don't know what ingredients they're using, but it is, because you would think that as a massive franchise, there would be a core ingredients that every franchise uses.
Mm.
Um, but for an American McDonald's to throw in 600 animals on average, and then you have an Irish McDonald's, it does actually make the Irish McDonald's that bit tastier.
Hmm.
Um, but it's just, you don't really, sometimes you never really know what you're eating, and then when you
Hmm.
find out, it's just very disgusting.
But even think about it. Is it that? Is it like, look, I mean, just in terms of substituting and stuff, is it
Yeah.
that hard to make a hamburger yourself from home, where
No, not
you
at all. I do it the whole
get
time,
you
and
get the raw mince, you crush it into the shape, you put it in the oven or you fry it, whatever you prefer, and then if you want to, you can get some potatoes, peel them, chop them, put them in the oven or put them in an air fryer or whatever you want to do, and it comes out like a burger and chips. Maybe it's not as tasty as
yeah.
the takeaway, but it's still a burger and
No,
chips.
look, it's great. I mean, I've made my own Big Mac before.
Hmm.
Even though obviously the sauce is going to be slightly different because it's like their secret recipe. But
Hmm.
it does take that little bit more effort and that bit more time. But I mean,
Hmm.
once you do it, the reward is worth it. Much
Yeah.
more, much more than actually buying the actual Big Mac.
Hmm.
Um, so I think once you actually, if you can dedicate a certain amount of time each day or each week to cooking something from scratch, and then, like, it is nice that you actually get to create something and put it on a plate, and then when you bite it, it, like, although it is tasty, the fact in your head that, oh, I made this,
Yeah.
it
Agreed.
it, it makes it that bit more nicer.
Agreed, agreed. And also, it means as well, I think one of the things I've learned as well is that when you cook something yourself, um, and you enjoy it or whatever, and you can have people over who eat it as well and enjoy it too, that's very
Yeah,
rewarding. And I think it also goes to show when you cook something yourself and people enjoy it, that when another person cooks for you, you actually appreciate it that bit more because you understand that the effort that went in, the ingredients had to be bought, the recipe had to be looked at, the effort of cooking it, the
yeah,
cleaning up, all of this that the person put in. You actually get to appreciate it that bit more. But if you're just eating the Big Mac burger that you pay for that comes in the box, maybe you don't appreciate the efforts as much.
yeah, 100%. I would even say cooking is really like an art form almost.
Mm-hmm. True.
Obviously you have these Michelin star restaurants.
Mm-hmm.
Um, you have other restaurants
Yeah,
that
but
wouldn't have.
that's what I'm saying. Of course, if you want to eat out, do it at a restaurant if you want it. Of course, you're going to get your nutritional benefit there too. You know,
Yeah,
if you
of
go
course.
for a dinner and it comes with carrots and it comes with parsnips, it comes with peas, broccoli, all this, or you're having whatever you're having, of course, it's going to have more nutritional value than burger, whatever. But and it ties back into what we were saying before about the choices. And this is what I think it comes down to about how the economy does at the end of the day. It'll come down to
Yeah,
the choices that people make in the aftermath of this virus. If people decide that they want to buy groceries from home and they want to cook at home more, um, then I think we will see that economy slip. But then the question is, I guess, whether the economy itself was sustainable in the first place.
Right, right.
That's what it will come down to. When people say we want everything to go back to normal, that's one thing I hear a lot of people say. When you want it all to go back to normal at the end. Was normal really that sustainable in the first place when we had rising CO2 emissions? We had a climate that was becoming unlivable for people living in Pacific Islands. You have all of these different cases to think about. So really, was it that sustainable in the first place? And are certain businesses actually, even if it creates jobs and blah, 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 were certain businesses, ones that were meant for the times that we live in today? Are they really that sustainable?
Yeah. I think, especially with America, with the issues that are going on now, we can see that their way of living wasn't sustainable. With the systemic racism, which is almost ingrained in the culture, unfortunately. And then even in China, where we saw when they went into lockdown, their air actually became so much more healthier to breathe. So I think obviously this outbreak is terrible for everyone, but I think the fact that if you actually sit down and think about it, there is so much benefits that we can now acknowledge, or we shouldn't have done that before. Let's not do it again. So I'm a big believer in everything happens for a reason, and although this is a worldwide pandemic, people unfortunately have died from it. I think it was bound to happen. So, this might not happen again, but I think the pandemic was going to happen anyway. It might have not been the virus. It could have been something. Even a few months ago, we were talking about World War III.
You mean that something was going to come and change the way things were anyway?
Yeah, exactly.
I gotcha.
If it wasn't coronavirus, it could have been World War III a few months ago with Iran and USA. Or even in a few months from now, there might be. Even in America, it looks like they're on the brink of civil war. So that if the virus didn't happen and George Floyd was killed anyway, it might have actually been much worse, the response, because no one was worried about the virus or social distancing. But no, I think something probably would have happened anyway. Make it out what you will. But I think the situation we're in now, it is quite important to just take the positives from it, rather than just always focus on the negative. But I think that's important in everything anyway.
Agreed.
And unfortunately, that's something the media don't seem to agree with me on. I was looking through YouTube there yesterday, and on the news tab, and it was all CNN, and it was just all, the titles were just all
upsetting story.
And then even the thumbnails they use, it's like they're purposely designing this to manifest fear within the public. And when they attacked the CNN HQ the other day or last week, whenever it was, at first I didn't understand it because I thought that's just a news company. What do they have to do with anything? But then I've really been seeing that CNN or any news outlet really, they just do always incite fear within the public. Because obviously if something is like if they have a scandalous title or thumbnail or whatever, people are going to click on it. And then that drives up revenue for them, and everyone is clicking on it, and then people just become scared and they're fed up. So although I don't agree with the reaction in America, I do find it very understandable, and it is very sad what's going on. But I think in America, maybe America especially, this kind of reaction is the only reaction they know how to get change. And it hurts me saying that, but even especially with the current administration, they have the peaceful protests. They're great, but unfortunately, with the current administration, I would think they're wasting their time doing these protests because Trump and his advisors, they don't give a rat's ass. Even now with all the chaos, it still looks like he still doesn't care. But it is, again, I still think it is very understandable. It's not something I agree with, but something has to change. I think America, especially, going back to Malcolm X, MLK, the racism in America, since we were talking about cooking, I think you can compare it to, you have a pot of boiling water on the stove, and now all the water is falling out of the pot. It was boiling for so long. For the last 70 years, they had this pot on the stove, and now it's finally overflowing.
Well, I think it's a good analogy, and I think it's something that we're going to talk a lot more about in the next episode too, about the aftermath of what's happened.
With James as well.
So that's something to look forward to. But thank you for the conversation. I've enjoyed it. I think it's been fun from my end to kind of give an insight into how things are in Sweden, and to talk about maybe more healthy and sustainable ways of living, and how maybe the world can react after this pandemic ends.
Yeah, no, look, I don't know how many people are going to see this, but hopefully someone can get some sort of benefit from the conversation we had, especially about, how to be healthier, or how to be more conscious or mindful of the food you eat, or exercising or whatever. So hopefully
even something as simple as being more skeptical of when somebody tells you something needs to be done.
Yes, of course. Yeah.
Even as simple as that.
Don't believe everything.
Yeah. So until next time, then, I guess we're going to sign off, and we'll see you on the next episode.
Absolutely. See you then. Take care.